the best way, doctor, to prevent heart diseases or diseases like diabetes and maintain good health?
Well,
big question.
It comes back to nutrition.
Nutrition. That's your favorite, nutrition.
Well, most physicians are not particularly trained very elaboratively in nutrition. And what I began to notice over the first, let's say, 5 years of my career, after patient interview and patient interview and patient visit and patient visit, what I kept getting asked about is, well, what do I eat? I would diagnose a patient with diabetes and they would say, okay, so what, I can't have sugar now? And I was repeatedly short with an answer because I didn't have a concrete answer. So I took it upon myself to really elaborate my knowledge as to, again, what are the hormonal influences of the food we eat? How does that change this chronic condition that I just diagnosed? What is really truly the play of what's on your plate and how that helps you? Now, the good news is that that helped me lose weight and that helped me sort of advance to a healthier weight and implement those strategies in my own life. And that in turn has helped me help my patients. So that's been fantastic. What I tell patients is that you're not going to have at least most people, aren't going to have the instinctual need or desire to go out and exercise every single day. But we know that every few hours or so, you're definitely going to be hormonally influenced to eat. It's part of your survival mode. So we have to spend more time, and we should spend more time thinking about what are we eating, what are we putting into our body, than exercise. Another common example that I tell patients is, how many times a week do you sit down in front of a plate of food? If we just do 3 meals a day times 7, if my math is correct, that's 21, correct? And what do we as physicians try to ask you to exercise? Oh, let's do 20 minutes 3 times a week. So that's 3 times a week versus 21 times a week, where you're now trying to implement these 2 separate strategies. So which strategy do you think I need to help you more with? I need to help you more with your nutritional strategy. That's where your bang for your buck is going to be as far as your healthcare future. We all get older at the same pace, right? So we need to make sure that you're implementing healthy strategies when you're in your 20s and 30s, so that when you're in your 50s, 60s, and 70s, you reap the benefits of the strategies that you implemented when you were younger.